of your time and respectful of that. So we'll get going here in about 1 minute. We'll let people hop on board. I'll just introduce myself while we're here in the wait time. My name is Heather Dye, and I work here at Huntington University in the Graduate and Adult Recruitment Office. So I'm so excited that we can bring this presentation to you today. I'm joined by Nathan Hawkins, who's our director. He's going to help manage and support any of your chat. If you have any questions, you can put that in the chat feature. Today is the beginning of a new Forrester Forum. This forum is a series that we're bringing to you to develop some continual connections and networking of shared information. So throughout this series, we'll be able to provide this network online so we can stay connected with you in effort to support the community and also to get information to help our students as they go into a new field in a new world that we're experiencing right now. Today, our discussion is going to be led by Dr. Carla MacDonald. Dr. MacDonald will help introduce our HU Bachelor of Social Work graduate and alumni students. We have with us from Aging and In-Home Services, Selena Myers, who works in Huntington County. We have Erica Downing from Parkview Health Systems, working in the Advanced Care Planning Facilitation and Instruction. We have Katie Davidson, who is a student in our online Bachelor of Social Work program. And during this discussion, we'll also be joined by Andrea Christner, who is a case manager for Aging and In-Home Services in Greater Fort Wayne, Indiana, okay? During this, please feel free, again, to hop in the chat, ask a question, look to share information or a comment, and we look forward to getting to know you. All right, Carla, would you like to begin with our discussion moving forward?
Thank you, Heather, and thank you, Nathan. I really appreciate you setting this up today. For any of you that don't know me, I'm the Director of Social Work Education at Huntington University, and as we were talking about this topic, I thought what better people than for me to go to our alumni, and we'll introduce them in just a little bit in terms of how they've had to adapt to online social work practice. And then Katie is one of our current students that's in our online BSW program. And Katie can tell you a little bit too about how our focus in terms of online and what we're doing. But I have a slide up here in front of you that I think anyone that is in the social work field today will know about the personal challenges that was put upon us in the middle of March from all of a sudden going from a profession that is very much relational focused, and then all of a sudden having to go to distance working, being socially distant from our clients, and how to do that. And rather quickly, we had to respond really quickly. And just, I pulled out just 4 of the 6 values of the Code of Ethics in terms of dignity and worth of the person, and how do we respect that? How do we honor that when we're working at a distance? You know, along with that, the importance of human relationships, and then obviously integrity. And you know, we think about we are now delivering services in an online manner. How do we assure such things as confidentiality? How do we prepare our clients when we don't see them face to face? You know, in terms of competence as well too. How do we assure our clients or the people that we're serving where we're coming from and what our background is, and how to get to know us? And so I've done a little bit of work, and I've had help with this with our current seniors in terms of talking about the importance of that when you are online and you're doing, you know, your online work with your clients, is, you know, obviously to think about that I'm still face-to-face with my clients, having that face-to-face contact so I can observe strengths and still focus my work upon the strengths perspective. I can be aware of their biopsychosocial needs in terms of recognizing very much the ecosystem theory, and by using such devices as Zoom, more so than just an audio or a telephone call, hopefully we can continue to focus in on those characteristics or those techniques that social workers use that I think makes our profession so unique in terms of that holistic approach of how we look at our clients. So I have some other things that I would love to cover here too, but I want to turn it over to our alumni who are working in the field in terms of having them respond to how does social work practice now adjust to COVID-19? How did they do it rather suddenly and yet do it with a focus of integrity and competence and the importance of the relationships with their clients? How did they do that? So I think if you could go to the next slide. We have with us in here just a little bit of background again, Andrea Christner, who is a graduate of our program in 2015, and she's a case manager with Aged and In-Home Services. And Andrea, correct me, you're enrolled right now in the MSW program at IUPUI, is that right, Andrea?
Yes, that is.
Okay, okay. And then Selena Myers, who's with us today, and she's a family case manager with Huntington County Division of Children's Services. And then Erica Downing, who's a social worker in the Advanced Care Planning Department at Parkview Huntington Hospital. And then Katie Davidson, who's in our online program right now currently, but also is very involved in working full-time in a local elementary school, Andrews Elementary, here in Huntington County. So she's had to make a major shift in terms of not being able to see kiddos every day to now focusing on other ways of, I know she's still connecting with those kids and how she's doing that, and also maintaining her full-time status in our BSW program. So Andrew, I might start with you first, if that's okay. If we could go to the next slide. Here are some questions that I suggested to our panelists that they look at. Please know that you're not totally bound by those, but those are just a kind of a guide. And so if you could go through those questions and maybe kind of address those. And Andrew, if it's okay, I'll start with you first.
Sure. So for the first one, the population that I work with is the elderly and disabled in community settings that need in-home services, and we facilitate those. So obviously, because of COVID-19, we are working remotely and doing everything over the phone. So just running through the questions, tangible community needs. I think for the most part, it's been food, because, you know, the clients that we work with are the population most at risk for COVID-19, so they shouldn't be grocery shopping and things like that. And also kind of just medical supplies like gloves, masks, which I think everybody's kind of in need of. What roles and situations demand face-to-face interaction? Right now, we're not doing any face-to-face interaction. So I think that there are, you know, situations that do demand that, like unsafe living situations or, you know, mediation between family members. But unfortunately, with the health crisis going on, we've just kind of had to do the best we can over the phone with conference calls. For my specific population, Zoom call just isn't feasible for them. Most of them don't have computers or Wi-Fi, so we don't really have that. They're not able to kind of tap into that advancement. That would definitely be like a great resource if that was more available to them. Thirdly, consideration should be considered. We are really trying to figure out when we're gonna start doing face-to-face visits again. We haven't heard anything, but once we're allowed back in homes, obviously, like the slide says, social distancing, probably wearing gloves and masks out, just trying to stay 6 feet apart from our clients, and just try to use those universal precautions to make sure that we're not bringing in anything from other clients' homes into another client's home. What lessons should we learn? I was actually just having that conversation yesterday with somebody that I think, you know, we're obviously learning a lot right now with COVID-19 and the health pandemic. For a lot of us, I'll speak for myself, I've never lived through anything like this. But I think it's just so unique to what it is. And I think every health pandemic that has ever happened or will ever happen is kind of just a force of its own. So I think, you know, we're learning how to social distance, how to do kind of more remote social work, which is a very interactive profession, and we're learning how to do the phone. But I don't necessarily know that what we're doing now will be used 10, 30 years down the road for another health pandemic. It would just depend on what, that consists of. So it's definitely an interesting time to be in the social work profession for sure.
Okay, hey, thank you, Andrea. I really appreciate that. I guess one question I'd have for you, Andrea, just real quick is, obviously when you were a student and you were, at HU, we didn't know this was coming. We didn't do
Right.
anything to prepare you for this. I guess what did you find? What enabled you to kind of just throw yourself all in doing this? Obviously, you knew it's what your clients needed, but I'm just curious if you could share with all of us what made it so that you made this transition so fast.
So we actually, and I don't know how Aging and In-Home did this. I'm honestly just still in such amazement at how quick and efficiently my agency was able to really get 30 plus office employees into their home within 20 days, or within 2 days, I'm sorry. Within 2 days, I can't even imagine the planning that they did in such a short period of time, but we really didn't have any kind of an option. We knew that we were going to probably lose the ability to do the face-to-face just because of the stipulations, with the virus spreading so easily. But I think a lot of us thought that we would still be working from the office. And we got the news on Wednesday, I think the second or third week in March, that on Thursday we were going to be transitioning to home. And, that's just kind of what happened. And we were all, I don't want to use the word forced, because I definitely feel very blessed and fortunate that I'm able to work, remotely and do everything that I need to do. But we really didn't have an option. So it was more just, taking the skills that, we all have as social workers to acclimate and kind of meet the needs to the best of our abilities and try to do it with the most positive outlook that we can. And so we didn't really have a choice, but I mean, it's been going good. And I'm very, like I said, I'm just astonished that my agency was able to do that so quickly and effectively.
Thank you.
Info about their role. Andrea, you've talked a little bit about aging and in-home services. If we could just talk a little bit about what your role is as you go through those questions as well.
Yeah. So I am a long-term case manager. So I have a case of about 65 individuals, mostly elderly, but definitely some with younger ages. And I am kind of the middleman between their home health services, and then the state of Indiana through the Division of Aging. So I facilitate services and just monitor their cases to make sure that their needs are being met, make sure that they have what they need to stay safe in the home. And so that stayed the same, in the midst of this health pandemic. The only thing that's really changed is we were mandated by state to make wellness calls every few weeks. So we're just kind of working our way down our client base for that.
Thank you, Heather. I'm glad you pointed that out. Thank you. Thank you, Andrea. So now I'm going to turn it over to Erica Downing, and Erica is also a graduate of Huntington University. And in addition to adapting her own role in terms of working off-site for Parkview, Erica has also been supervising one of our BSW senior practicum students this year. So not only taking care of yourself, Erica, in the sense of adapting to a new way of delivering services, but you also had a student. So anyway, but can you kind of, can you see the questions there that we have? And Erica, if you could address those questions and how as a Parkview employee, did you adapt?
Yeah, so my name is Erica Downing. I'm an advanced care plan facilitator and instructor at Parkview Health. So what I do is I walk alongside patients and their families to discuss what their wishes are for a time when they're unable to speak for themselves as far as medical care. We just think it's a great gift that you can give to your family. So it's a service that we offer to our patients and surrounding community for free of charge. So yeah, it's great. I love it. To answer your questions, Carla, the tangible community needs that clients have expressed, kind of tagging along to what Andrea said, you know, when we first saw this, there was the scarcity of toilet paper and things like that. So just making sure that clients have everything they need, the masks, the PPE wear, all of that. Those are kind of the things that we've seen. What roles or situations demand that there's still face-to-face interaction? So I work for Parkview Health, so we still have patients that are admitted to our hospitals. So we still have our doctors and our nurses and our therapy services and lab technicians and everybody that is still working face-to-face with our patients. So we're just making sure that they have everything they need to keep themselves safe, as well as our patients. Let's see, what considerations should be considered for social distancing if it were to continue? Kind of like what Andrea said, just making sure that we're maintaining the 6 foot, the PPE wear if we're going in and out of homes. I know for us at Parkview, we have a couple conferences that we're putting on in both June and August. So kind of thinking about what will that look like if social distancing continues? Will we need to, you know, limit the number of attendees that are able to come? Will we need to space out our tables more, limit the number of people that are at tables? Just kind of looking to see what we need to do to make sure that we're adhering to that if that continues. I think it'll become kind of a norm for us, as it has so far through this process, but just keeping that in consideration moving forward. As far as what lessons should we learn, I think really it's just being prepared. You know, like Andrea said, there was a 2-day time frame where they transitioned from office to home. Luckily for us at Parkview, I personally already had a work cell phone that I can use to contact patients. I have my laptop that I can take with me to and from. But for smaller agencies, I think it's just being prepared and having learned how to do that and just move that forward. Yeah, as Carla mentioned, I am supervising one of the senior practicum students. Her name is Molly. She's doing fantastic, but we really had to look at, what can she do from home? What, and still meet her learning objectives that we had laid out at the beginning of the semester for her. So she is a certified advanced care planning facilitator, which is part of her learning objectives. So she has been able to have conversations via the phone, because a lot of what we do is face-to-face, having those conversations. So we've adapted to having them over the phone or Skype or Zoom or FaceTime, kind of whatever is best for the patient. So yeah, we kind of looked at what projects can she do, what can she do from where she is, and she's done really great adapting as well. So yeah, did I miss anything, Carla?
No, no, great job. Thank you, Erica. One thing I would love for you to elaborate on is obviously, we as social workers, confidentiality is such an important factor in terms of our service delivery. And then with you working at Parkview Hospital, you have the whole HIPAA thing, and others probably have that too, but you really do. So how do you assure confidentiality when you're working at home? And obviously, you have other people in your home. Yeah. Your clients have people in their home, but how do you assure confidentiality? Could you just address that?
Yeah, so one thing, sorry, making sure I wasn't muted. One thing that I do personally is when I'm working in our charting system, so where all of the patient information is, I make sure that my husband knows that I'm working in that environment so that he doesn't come into my office to see anything that might be on my screen. So we kind of communicate that way to make sure that there's no information that might potentially be exposed. But then also when we're having conversations with patients via phone or FaceTime, however we're doing that, we give them a disclaimer pretty much that says, we want to offer this service for you, but we cannot guarantee that HIPAA secured line at this point based on the format that we are talking, and just making sure that they're aware of that and that they are agreeable to continue the conversation at that point.
Thank you, Erica. And I know that applies to everyone on our panel today, but I thought you kind of had that special heavy title over you in terms of HIPAA. I thought you could address that really well. Selena Myers is located here in Huntington, works for Huntington County Department of Children's Services. I always like to add that from the very first moment I met Selena as an incoming freshman, she said, I want to work in Child Protective Services. And that was a goal that never diminished during her 4 years at Huntington. And I'm so excited for her because now she's doing the job that she's always wanted to do, and has been doing that ever since she graduated. So Selena, I'll turn it over to you. And if you could tell us a little bit about how this has impacted you and your role of basically protecting children and safeguarding them against abuse and neglect. And so I'll let you just take it from there.
Yeah, absolutely. So first off, in my role, there's 2 different areas, and in my office, I take care of both areas, and one of them being assessments, where we get the calls that come in and you go out and you see, is the child safe? If not, what can I do to make sure the child is safe? And that is called the assessment area. The other area is the cases, which I also am a part of, where the children that weren't safe and we're doing interventions of some sort, and that's an ongoing thing. That would be our case side. So I think both sides have been affected in different ways. So for my assessments, I still have to go out and see them initially face to face, make sure that safety is there. So with that initial visit, it's so important for your engagement skills that you start with a good foundation, trying to engage the family that first visit and establish a good relationship. If you're able to do that and you can dig in really well that first visit, a follow-up visit can then be virtual. And hopefully can be virtual. Sometimes it can't always be, but a lot of times it's what we've been doing. And then you can work with them virtually versus having to do another face-to-face and risk exposure. And then also on that initial visit, like, we do have masks that have come out to protect us and those around us, that if there's any chance at all that we've been exposed or they've been exposed or anyone has any symptoms, we should be wearing those. And then we also have gloves and obviously hand sanitizer to be utilized at those visits as well. They also gave us probably 3 different trainings on how to make sure that we keep ourselves and our clients safe during those initial visits. And then for the case management side of things, I'm doing a lot more of the virtual contact. So my kiddos that are in residential placements, so those facilities are all shut down. You can't go onto those facilities right now and visit with kids at all. So I have one child in residential, and due to that, I do virtual visits with her every week. And now we're also going to be adding in, which I just heard about last week, a specific group of case managers that will be doing face-to-face visits, but only that one group will be able to go down. So I will continue doing my visits with my kid, and then someone else potentially will be going as well in person. And then for my regular children that are in foster homes, I do some of those virtually. If anyone has been exposed or has symptoms. If no one has been, then I'm still trying to go face-to-face as much as possible. We also have monthly meetings where some people are attending virtually, some people are in person. Again, it just depends on exposure and if anyone has symptoms. So before I make any contact, I call everyone, I make sure I ask COVID-19 safety questions, and before I enter a home, I ask them again to protect both parties. So that's kind of the biggest changes that's occurred with my client interaction. For me personally, as you can see, I'm also at home now. So when I'm doing my office work, half of the office or 3/4 of the office have changed to be at home to ensure that we have less than 10 people at the office at any given time. So anytime I'm doing office work, it's here unless I need to do printer work, and then we take turns going into the office for that. So that's an overall of how everything's changed. So I will go to your questions now, Carla, and be more specific with those things. So the first one is tangible community needs. So in my interaction with my assortment of clients, I found that income is really a big one because of stimulus checks. Some of them are delayed, or getting unemployment. That's been a real struggle because there's so many people trying to get unemployment. So one of the services that's been able to step up and help with this is Youth Service Bureau here in Huntington, and they have a grant that we can apply our clients for and request some special funding. And then another one would be insurance. So I'm pushing people to make Brightpoint appointments with Bowen Center who can help them get Medicaid set up during these periods of time where it's not available through their job. And then those face-to-face visits for my parents and the children that are separated right now, they've become virtual visits. Parents are really asking for those face-to-face to come back, and I'm just waiting for the moment when all of the organizations reopen for that. But in the meantime, I've changed those to virtual visits. For the second one, roles and situations, doing it, there is still an attempt to face-to-face. I think I pretty much addressed that one in the initial part that I covered. And then considerations that should be thought about for protocols to keep if this continues. So I think that we'll continue doing what we're already doing with face-to-face when possible and virtual when needed, just depending on those COVID safety questions. And I think one of the things that we're going to have to address as an agency is for the cases where parents are doing great and they're ready to move forward to in-home visits, we have to figure out how we're going to address that. So I think that's something that we still have to figure out as an agency. And then what lessons? I think in my agency, my monthly meetings for my cases, whenever I make a plan, there's also a backup plan. And I think one of those things I can add in there is if for some reason this can't happen face-to-face, how can we address this service still or this visit still? You know, and I think that's something that we can always address from here on out because you never know when something like this is going to happen again. So it's just important to have that in our minds as we go forward in planning, even when this COVID-19 stuff has concluded. And so just like connecting all of this back to the program at Huntington, I really think that Carla and Professor Sartoria set us up really well with like critical thinking. We wrote a lot of papers about critical thinking in different situations and with different clients. And I think that that really set me up for good engagement skills with my clients these days. And then the flexibility, we did a lot of different internships and practicums where I had to work with them with my class schedule and learn that flexibility. And that's helped me now with my clients because their schedules are all over and kind of adjusting that. And even now with the COVID, trying to figure out how to still maintain those relationships or build them. And always thinking about your clients first. So really engaging and figuring out what do you need from me and how can I help you figure that out. And then for confidentiality side of things, I'm at home by myself, so I don't have to worry as much about that. But when I do have another person in the house, I just ask them to go into a separate room and have the door shut, or I would go there, ask them to stay outside while I'm still working throughout that time period. And then for my clients, I think that's one of the biggest struggles for their services because they're in therapy, they have their visit with their kids, and usually they have other people around in the home. And so when they're doing their therapy sessions or when they're doing a group, I really encourage them to either go into a room and shut the door, or if that still isn't confidential enough, get in their car and sit out there. This way the family is not around, or drive to a different parking lot and park, or see if there's a friend that would be available that they're still seeing that they could go there. So I just try to encourage them to find a different spot to do their services in. So I think that covers it all. Carla, if you have anything else, let me know.
Thank you, Selena. Everyone here has such a critical role in terms of serving their clients, but Selena, I've thought about you a lot, during this past month in terms of, children not being at school, families being all together, children, if their parents are not able to work, that's just a lot of people in a household, even in foster homes. It's just, I can't help but think about the stress that people are going through. So I guess in your role in particular, are there things when you are online and doing, remote, casework and such like that, are there anything that we should all be aware of in terms of any red flags or things that people should somewhat tune into to know, hey, this is a situation that I maybe now need to go make a personal visit, or I need to bring somebody else in to provide additional support to this family or to these children? I'm just curious, what are some things that you might be looking for?
Yeah, absolutely. So I think it's really important to think about that. Like you were talking about, there is so many people at home, and the risk for child abuse and neglect is really high, but we can't really assess that because we don't have anyone making reports about what's going on in the home because no one's in the home right now. So when you're doing those phone calls, asking questions about your stress level, your self-care, depression, asking those specific questions I think are very important, because if that parent is telling you, oh my gosh, my stress level is going out the wall, maybe trying to figure out, through a mental health community, is there maybe a service such as like with Bowen Center skills coaches, you know, trying to get them connected there so that skills coach can reach out to them on every other day basis or a pretty regular basis just to check in with them and give them some of those coping skills. I think it's really important to push those people that we're having this contact with to reach out and make those appointments, because sometimes you can help and do that phone call with them and do like a three-way call as well. But that's so important because there isn't anybody that's really going into the home. So they have the availability to do those virtual contacts, push them to get into some therapy or get that extra skills coach like I mentioned. When you're talking with those kiddos, ask them about how things are going being at home with parents all the time and seeing like, how's it going with your schoolwork? Do you feel like you have that space to work on it? And safety plan with them, and how can we figure out how to get you into a spot where you feel good? And then if they feel that there's not really available, see if you can talk with their parents and talk with them about what's going on and safety plan with them as well. And then if obviously if anything concerning were to come up, we have the hotline, so you should definitely be calling that, and we can do a face-to-face visit if it is deemed necessary. So if the child is talking about discipline that's inappropriate, you know, if you're seeing when you're doing a virtual visit with them that something's not right in their demeanor or the way that they're talking about what's going on at home, and it seems that something else is going on and they're not able to open up to you about that, you know, or you're seeing marks and bruises on that child, ask them about what is going on, where is that coming from, what happened. You know, you have that rapport, so you can ask them a little bit and they might be willing to share with you. And if anything concerning is going on, please call the hotline. We will go out there and we will make sure that child is safe.
Thank you, Selena. And I just wanted to wrap up with our group of panelists with Katie Davidson. Katie is in our online program, and Katie and I have been talking in recent weeks. She's getting ready to do her senior practicum next year. And even though it's a little ways off, we're already starting to prepare for it. And one thing that I couldn't help but be thinking about is COVID-19, what's next year going to look like. So I've been kind of taking some things into account with that as Katie and I have been talking about where she's going to be doing her senior practicum. But Katie, your learning's been all online. You're an amazing student. You've just done an amazing job. Could you tell us a little bit about how you feel like the HE program is preparing you? You know, it hasn't been intentional. I wish I could say it has been, but we didn't know this was going to happen. But how do you feel like you're being prepared that if you would have to react and work in an environment like these other three panelists are doing now, how do you feel like you could respond, and what's enabled you, or what will it take to make you feel comfortable about being able to provide services remotely in your future?
You know, that's a good question. I actually thought about that. Through all my studies and all the things that I've learned, what is the most important thing that I've learned to be able to do this? And I think, you know, when we got the word from our superintendent that we were closing down school and the kids weren't coming back, you know, everything just happened all of a sudden, and it was like a rush, and for a little bit, it was a bit of a panic. And, you know, it was because we thought it might be happening, but we weren't exactly sure when it was going to. But I think with all my studies that I've done so far, I think that I've learned, especially still being a single mom, I've learned just to roll with the punches and just to, you know, just to keep moving day by day, you know, step by step, and just seeing the positive out of everything, you know. And the positive that I've seen out of all of this so far is the fact that my classes are still online. So my classes haven't stopped. I haven't stopped my learning. Other than not being able to go to work every day and see the kids that I'm used to seeing, that's been the hardest thing for me through all of this. But I think HU's done a great job. I think I could be prepared to do anything.
Thank you, Katie. And I didn't give you a chance. Do you mind telling everybody just a little bit about, obviously you're a full-time student, but before Huntington schools shut down, can you tell a little bit about what your role has been with the schools?
So I've been at Huntington County Community School Corporation since 2006. I've worked at Andrews Elementary. First, I worked as the clinic assistant for 12 years. And then the past 2.5 years, I've worked as the secretary treasurer.
Thank you, Katie. Thanks. So Heather, I'm going to turn it back to you. As you can tell, we've got some great information, and I'll turn it back to you, Heather, and let you take it whatever direction you'd like to go.
Absolutely. I know you've all shared a lot of information about social work and health professionals, always putting people first, that your clients are first. I'm just also looking to see if we could answer some questions about how you are caring for yourselves during this time frame as well. How is that impacted? I know, Selena, you've mentioned you're even doing face-to-face visits as you go into these situations. Do you mind sharing a little bit about how that impacts your work life? How are you adjusting?
So I think that at the beginning, we had a difficulty, getting masks and gloves just like everyone else did. And so that was pretty stressful for us, just because we don't know how we would address that. It was really a matter of figuring out how I could find those items myself to ensure my own protection until the state was able to bring us those items that we needed. And then, like I had mentioned before, I call all of my clients before I go as much as possible, and just ask them safety questions. Have you been exposed? Are you under quarantine for any reason? Do you have any symptoms? And does anyone in the house have any of those conditions, symptoms, anything of that sort, as much as possible? And then to protect myself, and then by wearing the PPE when I do go out there. So I think that those things are pretty critical. I know for the people in my friend group, it stresses them out more, I think, than it does me, because I just remember that God's in control, and He's going to protect me and my coworkers, and we're going out there to protect the child. And so if we're doing what we're supposed to be doing, He's going to come alongside us and protect us as well, So I just have that peace of mind in my brain whenever I'm going out, and it doesn't allow that stress level to get as high.
Absolutely. Thank you, Selena. I appreciate you sharing. Erica, can I ask you, you're in a little bit of a different environment. You shared a little bit about how you're in lots of different places at Parkview. It's kind of a role where you're meeting a lot of different needs. Can you share a little bit about how that's affected you personally and how you're working in that environment?
Yeah, so I said earlier that the Advanced Care Planning Department or program at Parkview is a system-wide program. So prior to COVID, I would go to all of our community hospitals if that was what was easier for a patient. So I was traveling a lot and doing different things like that. But now, I haven't been since COVID has happened, but I have been into our regional campus a couple times, one to see a patient in a patient room. So again, kind of like what Selena was saying, just making sure you're taking those precautions to protect yourself, as well as the patients that we're seeing. But yeah, so just, and really, like I said earlier, my role has transitioned to virtual. So I'm doing things over the phone, and not really getting to connect with the wider system as I was before, and I'm looking forward to doing that once this is past us again.
Yeah, absolutely. That makes perfect sense. Thank you, Erica. And Andrea, you shared a lot about the changes that you're making and what you're moving through and doing. As far as what you've adapted to, are there certain things that you'll continue to do in the future? Tips and things that you'd like to, that you found that are actually helpful that you'll use in the future?
That's a tough question. I think a lot of the tips that we've had to adapt, I don't think will stay like once we go back, because, so much of ours is face-to-face, and that is obviously a huge part that's missing. And I know every case manager misses it. So I think most of the things that we've had to adapt to, we will probably kind of let go of once we're able to do those face-to-faces, because we would rather be in the home and do face-to-face than have that be over the phone. So I think it's like a different set of skills that we've all had to adjust to. But I do think once, we are able to do those face-to-faces, we'll kind of just go back to that main beat and put these kind of in our back pocket for, I guess, another rainy day.
Absolutely. Thanks for sharing, Andrea. And Carla, as somebody who's been in this field for 30 years, teaching, training, and also working in that face-to-face modality and that we're talking about, what do you think that you'll do differently now that we've experienced a pandemic like this? What will you do differently in teaching and also guiding these new people going into the field?
Well, obviously it's something that we're working into our curriculum. When we've used case studies, now taking a case study and saying you can't see your client face to face, what would you do type of thing. So I see us taking more of a focus in that. I do have to say, and I love the panelists that are here in terms of just their willingness to share. Critical thinking is a big part of social work practice, and they reference that so well, that social work is not a prescriptive type of profession where I can say, if you're given this situation, you'll do this. It's not that way. Every client is unique, every situation is unique, and every environment presents a unique situation too. So I do think that we'll want to continue to focus on just that adaptability. Kate said it so well, being flexible and such like that. The other thing I did want to just mention that ties into your question, Heather, is I am just amazed at the resources in this area. And I know there's resources across the country as I talk to my colleagues that are going through the same thing that I'm going through in terms of, the undergraduate education and how are we adapting our social work programs. But for example, here in Fort Wayne, we have Mental Health America, we have Great Kids, and both of those organizations, and if anyone out there is interested in receiving information, send me an email and I can get you connected if you're not already. But they are doing some amazing online training through Zoom, like what we're doing right now, talking about the topic for in a couple weeks that we're going to talk about is suicide prevention. What do you do in terms of suicide prevention when you don't have your client face to face and yet you're concerned that they may be self-harming? What do you do? And so I've just been so impressed with the two organizations I mentioned, how they have adapted, and they're providing online training. They're providing it for free. And so for all of us with our license and maintaining our professional license, we can get those CEUs for free. And they're adapting to kind of the topic of the day that no one was prepared for. So I guess those are the things that I would want to do is, continue to base our foundation of our program upon the critical thinking model. Also be looking at the what ifs, how will we adapt and provide experiences for our students to relate to this, but to recognize that training is such a critical component in continuing to prepare all of us. So those are those things that I guess that I'm wanting to really focus on as we move forward.
Yeah, thank you, Carla. That's wonderful. The one thing I also picked up on as you were talking about working in the collective, obviously our participants and our panelists here are in all different areas and all different levels of community service to serve different populations. But what I'm seeing is that you're working together to get information. Katie, as someone that's moving into this field, what are you hoping that this networking brings about for you as you continue to go through your practicum, continue to glean from these folks that are on our panel and in our attendance today?
I think, there's nothing better than having a great support system. And if you can get little bits and pieces from, everyone that you know and everyone that you come in contact with, I believe you can learn something from everyone. And, sometimes the things we learn are not always the best, but still we are learning from them. And these wonderful ladies that I see before me just have ultimate, they're awesome information that I could just gather from. And Carla has just been a godsend. She, if I have a question, I can email her, she'll answer me, and I know she's going to tell me straightforward. So I just think that's wonderful that we just can surround ourselves with great support, and nothing but positivity can come from it.
Thank you for sharing that, Katie. And I'm gonna come back to, and anybody that would like, you can raise your hand and let me know. Selena also addressed a little bit of this, just talking about that self-care concept of what am I doing to promote this time frame. I'm at home. I'm not able to see my clients as much as I'd like. I'd really like to have more FaceTime. What are you able to do in your home setting to help promote good health for you too?
So I can start with that. So I think it's been a big struggle for me personally, going from being at the office every day with all of my colleagues and my support system around me there that understands, you know, the work that we're doing. And whenever I have a difficulty or want some support to kind of chat something out, there right there. So transferring from that and then coming home where I'm by myself all day, except for when I'm reaching out to people, I've had to be a lot more intentional, you know, to reach out to my coworkers and just kind of check in on them and be like, hey, how are you doing? And then also be like, do you want to take a few minutes to chat? Maybe that's a video call, maybe that's just a chat, whatever that looks like, but to have that extra support for myself, because I know that I'm a very people-oriented person. Most people in social work are, you know, so you kind of thrive on that people interaction that you get every day. And so when I'm home by myself and I maybe don't have any face-to-face contacts that day, I really have to be mindful about doing that. And then also taking my breaks. You know, when you're at home and you're sitting here and you're working, you're comfy, you feel like you can just work straight through, and then the sooner you finish it all, the sooner you're done for the day. You know, sometimes you just skip over your lunch break or you skip over your 15-minute break. And I think that I've really had to hone in on making sure I take that time for myself, especially because we are working from home. It's hard to create that separation. Like, this is my work, this is my home. You know, I'm sitting in my kitchen and later on I'm gonna cook dinner here. You know, how am I gonna separate? This is my workspace and that's my kitchen space to eat dinner, you know, and because the more you have them together, the more that those thoughts are always together versus being able to shut it off and do self-care for yourself. So I think even for me, it's on those breaks, it's a matter of doing a personal thing, like maybe working out or maybe taking a walk or maybe calling my parents, whatever that looks like. I think it's really important that we work on that self-care piece even more so when we're home.
Absolutely. Thank you, Selena. And Carla, just to help us, we're getting close to a time that we're going to start wrapping up. We're being very respectful of our time that we have with our panelists and our attendees. We want to just remind everybody that this is recorded, so you'll be able to see this in the future and share with others, whether it be other people that you're not working side by side with. Like Selena said, in offices, you can share this information so that they can learn alongside us as well. Carla, in wrapping items up, are there topics that you just like to let people know that this current situation, of course, is temporary? Moving forward, what should we look for in social work and dealing with this current pandemic?
Well, I don't mean to be a Debbie Downer, but I don't know if it's temporary. You know, I always try to look at my glasses being half full. And I know none of us went to school to be a social worker, to be looking at our clients, you know, through a screen and such like that. But I think that as social workers, we just need to continue to look at what are my clients' needs, you know, how can I serve them? If I can't take path A, how can path B still meet their needs? One of the biggest things that as I've been looking at this with our current students and their senior practicums, as well as just staying in contact with the folks here, is I recognize that as social workers, we still need to engage with our clients. And even though we're not in our office, our kitchen, like Selena's in her kitchen right now, you know, or me, I'm literally right now in my grandkids' toy room. I've pushed some toys away so you don't see them in the background. But anyway, but that we still do the same things in terms of engaging with our clients and assessing our clients, that we still do the same thing, that we still respect their privacy, that we look at in terms of their ecosystem, in terms of, you know, looking at them from a strengths perspective, that we still do the same thing, but just adapt how we're doing it. And to ever be so, you know, aware of our clients' dignity and, you know, that importance of human relationships. So I guess that's what I would have in closing. And several of them said about support systems. I have found those to be so critical right now because you do feel so alone. And so I think just continue to schedule, those Zoom meetings whenever you can get together with people. And maybe this is going to be over next week, but maybe it's not. I don't know. And I think we just have to continue to just look at what's the needs of the client, and then what path do we take to reach those needs.
Absolutely. I think that's great advice. Great moving forward that we're taking something that has occurred, like you said, Carla, unexpected, not planned for, but in this community, everyone's doing the best to network and work together in the collaborative. So if there are any questions in our chat, you can definitely ask our panelists anything that you'd like to follow up. You can reach us at our graduate and adult admissions office, or you can also reach Carla directly to ask any questions about how she can support you in the community. Thank you to Erica and Parkview Systems for being with us today. Katie, sharing your experience as a student. Andrea and Selena, both from Indiana Aging and In-Home Services. We appreciate your time and the information that you've shared with everyone here today. So in closing, we hope that you continue to stay in contact, and we look forward to seeing you at another Forrester Forum in the future. These are completely free, and the goal of Huntington University's Forrester Forum is to really just invest in our community and continue to stay connected at all times.